Is LA safer than GA? Question mark. That is, how do you answer that? What do you want? Do you want the long answer or the short answer? So the short the short answer is yes. In general terms, LA is safer than GA. Well, LA, by the way, is local anaesthetic, and GA is general anaesthetic. So local anaesthetic means you get an injection in the place where you're doing the surgery. So stuff like a mole, a cyst, an earlobe, a nose, you know, something localized thing, you would inject the anaesthetic in the bit like the dentist, basically. You inject the anaesthetic in the bit, and then you have you're totally awake. Boom, walk out the door as soon as you've had it done. That's it. Happy days. General anaesthetic means you get put to sleep. You're out. It's a general anaesthetic. You have to go to the hospital for that. You have to be starved beforehand. You feel a bit groggy afterwards. When you're comparing local and GA, I'm assuming you're talking about local and sedation. So normally when we do bigger case, so a mole or a cyst or an earlobe or a small procedure on an adult would pretty much always be done under local anaesthetic, and I don't think it would be right to do it under general anaesthetic. Some people say, oh, can't you put me to sleep? It's just not worth it. It's not worth the cost of it. It's not worth the risks of it. It's not worth the hassle of it. You've got to be in hospital. You know, you can usually go home the same day, but it's quite a big deal having a general anaesthetic. So for a small op, a local anaesthetic is the way to go. This question, I think, is probably aimed more at the people who are having bigger ops, things like breast enlargement, breast lifts, well, to be honest, anything really. You can have mastopexies, tummy tucks, facelifts. You can have all sorts of things under local with sedation. So it's not the same as local anaesthetic. You're not totally awake as you are with a normal local anaesthetic. You're sedated, so you're asleep. But the recovery is quicker, and it is safer than a general anaesthetic. Now, I will what's the word? Sort of put a rider on that sort of thing. Anyway, I will put a rider on that by saying that it depends on the case. So some cases, you know, like a tummy tuck with muscle repair, submuscular breast augmentation, you can do these things under local and sedation, but it might be a bit uncomfortable. Liposuction can be a bit uncomfortable. They can be all done under local and sedation, but it might be a bit uncomfortable. So you might be better off with a general anesthetic, because we don't want to make you sort of traumatized by the procedure. So it really does depend on the patient, to be honest with you. And if the patient is engaged, really unhappy about having a general anesthetic and really wants to have a local anesthetic, then these patients are often the good candidates for local. And certainly a breast enlargement on top of the muscles, something like that, you know, can be quite relatively easily done under general anesthetic. We do them with an anesthetist, done under local sedation. We do it with an anesthetist. We do it in the hospital where they can do a general anesthetic, so we can always convert to a general anesthetic if needs be, but it's often doable. And if someone's engaged and wants to have it, then it is a good thing to do. If you're not engaged and want to have it, then it's probably just as well to have a general anesthetic, because it's the risks are very small. So although the risks are less with a general anesthetic, the risks are very small.